Surgeon General, he's basically saying, hey, this is bad. We got to do something about it. Next.
1 second.
Surgeon General, he's basically
Sorry.
saying, hey, this is bad. That may be my computer. Next.
1 second. We were just restarting the stream.
Yeah. Oh, go ahead and restart the screen. We've got a few people online as well. That's what this little camera here is for. The reason you have the handout on your chair is, for those of you who attended the last one where I was running the tech, it was a complete disaster. So in order to not repeat that, Andrew's here this time, so everything will work, but in order to not repeat that, I decided we're gonna have paper, just in case all fails. So that's why you have the handouts.
We're all good.
Thank you, Andrew. See, I knew he was gonna do this, right? The first thing to understand is there is a difference between social isolation and loneliness. Now, many of you know this, but just to make sure we're all on the same page, isolation means you're physically isolated from other people. You know, when you say I feel alone because there's no people around me, that's isolation. It's a physical separation. For instance, if you have mobility issues and you can't drive to the typical places you go to, the senior center, to church, to your friend's home, then you're physically isolated from people. Rural people in rural communities tend to be more isolated by definition because they don't have a place they can go to easily. It may lead to loneliness, okay? Not always 100%, but there's a fairly strong correlation, as you can imagine. Loneliness, on the other hand, is a psychosocial condition. Some of the loneliest people are in New York City with millions of people rubbing shoulders all the time, okay? A lot of times for older adults, it's predicated on the loss of a spouse. And that is probably the number one reason when people feel lonely. Or loss of family and friends. How many of you heard the people that you care for saying, I'm alone because all my friends have passed away, right? You've heard that, and that's this particular reason right there. Or they move to a new environment, and that is one of the key places too. I had a client, not in this beautiful community, it was still a beautiful community and it had nothing to do with the community because the staff did the best job they could. But what I usually do is I try to talk them up, right? I try to go and make a few jokes and all that kind of stuff. Didn't work. This lady didn't talk to me, didn't look to me. She was so, clinically depressed that we heard within a couple of weeks she had moved out of the building. She just couldn't take it there. She was in a building, she was not isolated, there were hundreds of people around her. She refused to go down to dinner, refused to talk to anybody. It's a psychosocial issue. And moves are very difficult. Some of you here are referral agents, you guys will know. Moving is difficult. And sometimes you may think that they're moving to a beautiful community, it may not work out. And it's not on you, you know, because they may not be able to handle that move. Just go on. Okay, so the one thing, here's the theoretical part, and there will be a quiz at the end of this, just to make sure you really get it. John Cacioppo is my hero because he wrote a book called Loneliness on the Lonely Brain, and he literally did a ton of studies, University of Chicago, and to understand loneliness. He was the first person who actually started doing actual research on loneliness, particularly. And what he discovered is the brains of lonely people, in contrast to non-lonely people, are on high alert for social threats. So lonely individuals tend to view their social world as threatening and punitive. What happens, and you've probably seen this, is when people are lonely, they tend to push people away. Now, if you think about it, if you're in pain, like if you put your hand over a hot stove, your natural reaction should be taken away, okay? Pain is a response. Loneliness is a pain. And the natural response to loneliness is to seek community, to go out and meet people, right? But people who've been lonely for a long time, it actually becomes a problem because they don't seek people. In fact, they push people away. So there are some people that you think, well, you know what, they just want to be left alone. They say that and all their actions show that they want to be left alone, but actually it's because their brains have changed. And John Cacioppo went as far as taking MRIs with these patients, and he actually showed that their brains had changed, okay? Not that they had dementia or anything, but actually how it changed. So be on the lookout for some of these people. And it's not easy. You may say, well, I've identified, that you need some community, and you drag them out there, and they're still not gonna like it. It takes a long time to get them out of it. And the other thing is they have more negative social impressions of others. I'll give you a story. I had a neighbor who passed away about a year ago. She was in her 90s. And I've been living on the same street for 30 years. So I've known her for a long time. And for 30 years, she lived alone. She was divorced. She had one son who was estranged from her, didn't talk to her. She was in the neighborhood, and I knew everyone because I'm the village busybody, as you guys know. I knew everyone. A new neighbor moved in, I'd go in and bring cookies and say hi to them, okay? I was one of the few people she would allow me into the house because I helped her fix her house, okay? Light bulb went out, I'd fix it, something went out, I'd go fix it. So she was one of the few people I liked, but everyone else she absolutely hated. And she never had a nice thing to say about anyone. She was lonely. I knew she was lonely, but she pushed people away. And none of the neighbors wanted to talk to her, okay? And she kept telling me, all the neighbors hate me. She's probably right about that, but she didn't realize that she's the one pushing them away. And she's the one saying negative things about everyone. So, doesn't mean they don't want the community. She really wanted it, but she didn't realize that her loneliness over 30 years was pushing people away. Let's go to the next. Okay, you've heard of some of this before, social determinants of health. It's becoming a big thing. The government this year is asking hospitals to measure SDOH. Now, what's that mean? How do you measure social determinants of health, right? You've got socioeconomic factors, like education, job status, family social support, income, community safety. Some of these are easy to measure, okay? Physical environment, where they live. They say that your health, for the most part, can be easily determined by your zip code. That's what a lot of insurance companies do. They ask you for your zip code, and then they have all these actuarial tables, and they kind of have an idea of what your health is going to be like. Okay, now that's very simplistic, but that is essentially an SDOH. Now what's interesting is the healthcare professionals, any healthcare professionals here? Contribute about 20%. The rest of the 80% are social determinants of health. So they actually found out, and the federal government finally wised up and said, you know what, we need to measure the social determinants of health because it turns out that actually that has a greater impact, twice as much than medical professionals try. As doctors, you may say, well, I'm giving my patients the best advice and I'm giving them the best medication. The compliance is not very high, okay? They found that the people with good social support, the daughter will nag them to take the pills. If you don't have good social support, you don't have a daughter that's gonna nag you, you're not gonna be compliant with your medication routine. And guess what? Your health is gonna suffer. So that's the reason why SDOH is important, why the federal government is starting to measure that. Next. So how do we get here? Let's go to the next one. Now, I'm a little bit of an amateur sociologist, psychologist, so I like to look back. Now, I'm not going to go back all the way to hunter-gatherer days, but I'm going to kind of look at what's in our DNA and what we're programmed to do. So, most of human existence is an agrarian society. People had farms, and there was a kind of a village in the middle that you went to, okay? And the key thing is we are a social species. Doesn't mean that we're friendly with everyone. We're more like dogs, where we exist as a pack, as opposed to lone animals that hunt alone. So we actually need each other to survive and thrive. That's burned into our DNA. Next. So this is what happened. As we became an industrialized society, something happened. In many ways, our lives improved, and I wouldn't want to go back to live in an agrarian society. It's really hard, even though I love farming, and Andrew knows I have my hydroponic farm in the backyard. But I don't want to do that as a living, okay? It's really hard. And part of what's happened with industrialization is we've developed this concept called independence. How many of you have heard of clients say, I want to maintain my independence, it's so important. Here's the thing, the reality is our DNA tells us that we're not actually truly independent. In other words, can you go live on a desert island by yourself with nothing else? That's true independence. We're actually interdependent. We're depending on other people around us, and that's the key thing. We've lost a lot of that when we move to an industrialized society. Next. And this guy, how many of you read this book? It's a great book. It's a thick book. Now this guy, Robert Putnam, he is a statistician. And you can see from what he does, he's collected a lot of statistics over the years. The title of the book is Bowling Alone. I'll just summarize it in a couple of slides. And his subtitle is The Collapse and Revival of the American Community. Now he's a little optimistic when he talks about the revival of American communities. We're not there yet. Next. So what happened to the community? He basically goes through the Industrial Revolution, again, industrialization, growth of cities, moving to the suburbs. By the way, the suburbs are one of the main reasons people have lost community. It's very unfortunate. Suburbs were not designed for community for the most part. Now, some of the newer developments have started to do more of that. Families are moving away from each other, particularly in the US. This is a very American phenomenon where people are very mobile, right? I'm sure many of your clients, their kids don't live anywhere close to them. They're thousands of miles away. And generational change in values, right? The whole thing about, hey, you know what, we need to stick together, we need to support each other, a lot of that's gone away. Hey, you know what, we need to be independent. We need to rely on ourselves and nobody else. I want to do things my way and no other way. Next. So he defines community in kind of three layers: the intimate, which is your family and your close friends. Now here's the thing, a lot of people tell me, well, you know what, I don't get along with my family. There's nothing that says that you have to like them, but they still have to be there, okay? That's part of the social contract, is they are supposed to be there for you. Close friends as well that can help. I know a lot of people who are helping their own friends kind of age and make a lot of tough decisions. The next group's the relational, which is your work, your school, your social group, etc. And the collective, which are your village, your town, the people you meet out there in the bank, at Safeway, etc. That you kind of know, they know you by name, but they really don't know you. Are you going to pick the phone up and say, hey, I need help? They're not going to come pick you up, okay? Next. And then last slide, he's going to talk about what's called social capital. How many of you heard the phrase social capital? There you go, you've read the book. All the way to the end, I hope. I actually made it all the way to the end, Tina. It's not easy, yeah. A lot of statistics. But he talks about the success of an economy based on three things. And most people, when they talk about economy, they mean financial, which I didn't even have here, up here, physical, right? Physical, financial, goods, resources, human capital. But he actually came up with this concept, which turned out to be really important, which is social capital. What is the strength of your social networks? And the key thing I'm going to talk about here is what's called reciprocity. Next. And he mentions two types of reciprocity, okay? One is specific, which everyone knows. You do for me and I'll do for you, right? If I do something nice to Mike, I hope he does something back for me. There's some implicit unwritten contract. If I do something for you, you do something for me. That's specific. But what's important in social capital is what's called generalized reciprocity. And this is something that a lot of you do. I know a lot of you volunteer a ton of your time to help other people who have no way of returning the favor. And let me tell you, that's important. That's what we need to have in community. And the hope is that when you need it in the future, somebody else out there, not the same person, but somebody else will come in and provide some assistance to you. The phrase we use is pay it forward.
Yes.
Again, many of you do that Thank you for doing it. Keep doing it. You're a great example to the community. Next. Okay, so this is what Mr. Putnam has found in the trends of civic engagement. Okay, it kind of went up after World War II, which is kind of not a surprise. After a terrible war, everyone came together and said, you know, we need to support each other. Not a surprise. And then when the boomers, and I'm a boomer, we caused the problem, because see what happens when we came along? It went down, down, down. That's why when I said his title is The Revival of American Community, it ain't happening yet. I'm trying to see that curve go up. When he measures these things, it's not coming back up yet. Next. And so you see with the village and the family, you've got great social capital. That's the thick green stuff. Again, it doesn't mean that they needed to get along, but there was this obligation that you had to help your next door neighbor. Today, it doesn't happen. I did, whenever I go to a conference, and many of you do this too, around the table, I'll ask people, do you know your neighbors? Do you know the people who live next to you? Do you talk to them? And you know what? Almost nobody says they know most of the neighbors. Again, I'm the village busybody. I know all of my neighbors. And it's interesting, the people who knew the least of their neighbors were the people from New York City. The most crowded city in the US. Nobody knew the neighbors or wanted to know the neighbors. And this is interesting because this was a conference that was talking about social isolation. Okay, next. So who is lonely? By the way, I'm kind of going through these slides fairly quickly because for people who will be listening to the recording later, they can kind of get through this. But I do want to make this fairly interactive because I really want to hear from you guys. I know many of you have a lot of rich experience dealing with people who are isolated and lonely. So who's lonely? So, as I mentioned in the studies, most people feel lonely, especially if a spouse passes away. So family and friends passed away, moved, or forgot about them. Now, with people living into the 90s and 100, I mean, I've got clients who are 102, they have cognitive issues and they're gonna forget some of their friends. It's natural, this is gonna happen. We talked about unfamiliar surroundings, having to move, which we all know is the most stressful thing that people have. At the end of their life, having to move somewhere, even if it's a beautiful community like this, psychologically, it's very stressful for them. And they have lost that sense of space. And I know that a lot of people, and I do, support many of you who want to help people to age in place. I think it's wonderful. And a lot of reason is that sense of place. When I talk to some of the people, I said, well, why do you want to stay here? I mean, they're literally on the edge, right? They can barely survive. But no, I know my little grocery store. I know my routine. I want to stay in this place. I'm like, you don't know any neighbors anymore. They've all moved away except me. And they're like, no, I want to be in this place, right? And so it is important to create and recreate that sense of space to them. There's a community, I don't know which one it is, that basically took a picture of the front door, you've seen this, right, of their old house, and they basically print out a giant life-size version of it, and then when they move into the community, on the door, they'll put a picture of their front door. Because it gives them that sense of place, that sense of what home is to them. Let's keep going, next. Okay, identifying loneliness. This time, I'm going to make it a little interactive. I'm going to kind of throw out a few things. First of all, it is underreported. Many people feel there's some kind of shame and they kind of deny. I mean, we deal enough with denial in the aging industry, but loneliness is one of those things. There's a lot of shame associated with it. I don't know why, right? But whenever you ask people who are clearly lonely and ask them, hey, do you feel lonely? They're like, no, I'm fine, right? That's the standard answer that a lot of people give you. Now, the simple ones are the obvious depression symptoms. Now, a lot of you probably deal with older adults who are depressed. You can use the geriatric depression scale, the GDS, to measure all any of these, but I think many of us intuitively will know, like the lady I talked about, who basically didn't talk to me, didn't have eye contact, nothing. It's pretty easy to see some of those as obvious depression symptoms. that is something that is related to loneliness. May not be, it may just be depression, okay? So, but this is one of the things. As I mentioned from John Cacioppo's study, suspicion and aggressiveness may be a sign of loneliness. Things like loss of vision and hearing and speech could be factors that could contribute to loneliness, so watch out for those. And here's the thing, somebody may look perfectly fine and there may be no outward symptoms, but once again, it is a psychosocial condition, so you may not know until you talk to them a little bit more and understand what's going on. I'm just gonna open it up, just yell out, what other things have you known to identify loneliness? Now I realize I've talked about the difference between isolation and loneliness. I'm kind of lumping them because there's so much correlation. So when I use the word loneliness, it's mainly the psychosocial element of loneliness. So, folks, Tina, I'm going to call on you because you read the book, but any specific, now she's awake. Any other things that you look for loneliness? Go ahead. Oh no. Okay, he's staying back after class. Anyone? Mike, you've seen a lot of people.
Yeah, I was trying to think from the list, and certainly you get people that are frustrated, and they don't understand why they're frustrated. Well, obviously, but it's,
Yeah.
And so they'll lash out people close to them.
Yes.
So there's a lot of that going on, and they're unhappy. They don't know why they're unhappy. So it must be my family member or my loved one is not doing enough to take care of it.
Okay, good. Karen, I'm going to pick on you as a geriatric care manager.
I was going to say there's often a confusion between dementia and depression.
Ooh, we're going to talk about that, but yes.
And one other thing, I had an interaction with the sisters, and somebody is parked in one of their spaces, and they've asked if you can move your car if you have a Lexus with a license plate 5 SKD 978. It's a gray Lexus.
Anyone?
Appreciate.
It would be a nice thing. Oh, it's you?
It's mine.
Okay. Okay, if you don't mind moving it, you may have to move out, and then don't worry, we'll make sure that you come up with your 2 minutes. Anyone else? Yes.
Sometimes sleeping too much or not enough.
Oh, yes. Yes. Very good. Very good. Sleeping too much or sometimes not sleeping enough. That's a really good one. Absolutely. Yes.
Overconsumption of Netflix or TV watching.
Yes.
So over.
Yes. It's getting lost. And for the recording, I'll kind of repeat some of these things. Overconsumption of Netflix or TV is a way to kind of drown yourself and just not remember that pain of loneliness. Yes, go ahead.
I've had a few, not often, but like they will go to the hospital and they're refusing almost to like recover because they're afraid to go home because they're getting so much attention at hospital. There's so much stimulation, and when they go home, they know they're not going to do anything.
Yeah.
So
people want to stay in the hospital.
yeah,
even
not
though
get better, like
not.
refusing.
Oh, right.
Yeah,
They
like,
don't want to
or
get better.
skilled nursing, refusing therapy because they're getting so much attention and stimulation there that they know when they go home it's going to be.
Yeah. Have you heard of the one? There was somebody who did a study on 911 calls. And there was actually a fair number of people who called 911 not because they had an emergency, just because they wanted to talk to somebody. So one of the resources that we'll talk about, and Rebecca will come back, she's one of the resources. One of the resources is called the Friendship Line. Many of you have heard about it from Institute of Aging. And what they do is they get a lot of referrals, okay? So that, and it's a warm line, so it's not a hot line. So it's a warm line so that you can talk to somebody for 10 minutes if you just wanted to talk to somebody. That's great. Let's keep going. Next. Okay, you mentioned dementia. So there you go. Dementia and loneliness. Let's just say it's complicated. It's very complicated because of dementia. My mom had dementia. She passed away a few years ago, but she had it for 10 years. And she lived with us. And it made things really complicated. For those of you who work with folks who have Alzheimer's and dementia, hats off to you. My gosh, I could barely handle one person. And it is really hard. So a diagnosis of loneliness with people with dementia is really hard because they could be changing all the time. They could be really aggressive. You can say, oh, that's loneliness. Well, it could be aggression, okay? It may not be. And I think the important thing that I've seen some of the best practices is just being present with them. Now that doesn't necessarily mean you need to drag them out of the room for every activity, because in some cases, too much stimulation is bad for them. It causes aggression, agitation, but sometimes being in a room for too long. And it's hard because they can't necessarily tell you what they need. So you just need to try different things with people who have dementia. Now technology may help. I know you've heard a lot, and Andrew and I have certainly talked about technology in our annual update. Things like robotic pets, for instance, either the Paro or Joy for All Pets, you know. But what we've learned from the people who've done this well is you need to integrate it with a program. You need to really understand and study how it's going to work and make sure it's working and monitoring. You can't basically just buy a Joy for All Pets and throw it to them and say, here, this will take care of the problem. A psychosocial issue doesn't have quick fixes. That's the thing. It has long-term fixes. So dementia is one of those things that makes it complicated. Next. Okay, what can you do? I'm sure you're all waiting to hear what you can do. Next.
There's a lot.
So the Surgeon General recommends a whole bunch of things. He's got this 5-point, 6-point, you're not supposed to read this, and I didn't even bother putting it on your thing. You can find it. Just go to HHS and you can find all the things about what the Surgeon General is talking about. Now, he wrote a book called Together. How many of you have actually read the book? Tina, have you read it?
Together?
Together?
No.
No, okay. Nobody?
If I had, I wouldn't say that because it's all one.
Tina knows it now. Okay, so Together is an interesting book. So the Surgeon General, Dr. Murthy, is actually the second time around that he's done this. He was a Surgeon General, and then he took a break, and then he was called back to be the Surgeon General. But the first time that he was the Surgeon General, what he did was he went on what's called a listening tour. He wanted to understand what was going on across America. So I don't know if he took a bus or a car, he flew, but he went around to different places, cities, suburbs, rural areas, to just listen to people. And what he expected to hear and to measure were the usual things, you know, smoking, diabetes, heart disease, all those type of things, which is typically what Surgeon General has been focused on. What this Surgeon General saw and observed was interesting because he said loneliness is an epidemic across America and it's causing a lot of problems. So he wrote the book, even before the second time he became Surgeon General, he wrote this book called Together, which apparently nobody has read, but you should. It's a great book, and it talks about this listening tour, talks about all the wonderful things that he is doing. Now the reason I put this in such small type is because it's not typically something that any of us individually can do. He's the Surgeon General, so his recommendations are more wider at the city level, okay? This is what the city should do. Now, unless any of you want to be a mayor of a city and make these changes, you're probably not going to be doing this. So, but this is something that is important to do. So next, we're going to skip, yes, Tina?
Just real quick, there is a very good book by a lady named Sherry Turkle, and it's called Alone Together. And it talks about, you know, the phenomenon of how we can be around people, but we are isolated.
Yes.
Yeah, so.
Yes.
Anyway.
Thanks, Tina. Alone Together. Sherry Turkle. Now what's interesting, can you go back to that one real quick? Now one of the things that Dr. Murthy talks about is the danger of technology.
Yes.
Especially with younger people, all younger people here, we're talking about you now, okay, with technology. And he talks about reform digital environments. We must critically evaluate our relationship with technology. what he found was a lot of very negative impact of technology, especially younger people glued to their phones. You know, he basically said, you know what, this concept of social networks, hopefully nobody here works for Facebook, but this concept of social networks is actually more dangerous.
Yes.
Because it puts you in a position where you're comparing yourself with other people.
And that's how they become depressed.
Exactly, because everyone is of course posting their best memories, they're not posting all the rest of their life. And you're comparing to everyone, and I'm saying, oh my gosh, Andrew's having a great time. Or, you know, I'm looking at, you know, hey, Mike went to this place, you know, and I'm like, I never get to do all these things. But that's the problem, right? Is everyone, and of course, you know, social media is like padding your resume. You guys know about that. I'm sure nobody's done that, right? But you kind of make it sound so wonderful. My life is wonderful. And so he's actually specifically calling out the dangers on some of these things of social media. I've had some older adults who basically said, you know what, I'm just going to quit social media. And they just got out of it completely. Which is, for them it's fine, except they're kind of missing out the updates from the grandkids. And a lot of times that's the only way to get the updates from the grandkids, because that's all they're doing. By the way, grandkids are not posting on Facebook, because Facebook is now for old people.
Right.
I don't know if you heard that.
They're on TikTok.
Right, that's right. If you're still on Facebook, you know what I mean. Okay, next. So this is something, you know, I started doing this about 20 years ago when my wife and I started going to visit older adults. So we belonged to a church in Palo Alto, and we were part of the visitation ministry. And what we found is that there were not enough volunteers to go visit these people. So we decided, you know what, we're just going to call them on the phone, and we're just going to call multiple of them on the phone once a week, twice a week, and we're just going to have them connect to each other. So this is actually my own research, and I came up with this concept called the 3 cons, which immediately after I felt was not a good thing. I am not a marketing person, as it's clear. But what are some of the things that is important for older adults for meeting a purpose? I've actually published this in CSA Journal, for those of you who've read it. So one of the things is control. It's important to allow them to have some sense of control. We work with people who can't even get out of bed, but we give them some sense of control. When we play bingo, we basically say, hey, how would you like to come up with the rules of the game? They feel that little sense of control because they've lost almost everything else. It's important to give that little bit back to them. Connection, we've talked about the connection already a lot, but this is the key observation I made, which is contribution. That's the human part of us, is we want to feel like no matter what state we're in, we are helping other people. They want to help other people. We all want to help other people. So it is important to contribute. In one of the groups that I led, we actually found one lady who felt really bad because she had cancer 7 times. And she's like, you know what, I'm sorry I keep having to share these things. I feel terrible. And you know what's interesting is one of the other people came back and said, thank you, because it allows us to encourage you. They were offering support, and that emotional support gave them that purpose, that contribution. And we kind of discovered this over doing this for a couple of decades, that it's really important. And one of the things that a lot of people think, hey, you know what, if I get a young person to connect, and I'm not dissing any of those programs, I think it's wonderful. I think tech support with the younger people and older people is a wonderful idea. But in terms of socialization, a lot of times it comes across as, I'm here to help you. You are not giving the older adult the opportunity because it's a one-way street. So we're always looking for opportunities so that no matter what the state of the older adult, there's always a two-way street. So when we have these different audio conference, video conferences, what we try to do is gel the group. And we as the host, we try and step back so that we can disappear and allow them to support each other. So anyway, the 3 cons, there you go. That's my contribution to psychology. Next, what are some things you can do to take action? Well, one is educate yourself. If you're interested in the resources, I ran out of space in the paper. I was too cheap to print a 3rd page, but I have tons of resources, but I have my email there. So definitely email me. I left my phone number there too, but I'm probably not going to pick up the phone because I got too many scam calls. So use my email, please. Have a discussion with your colleagues and friends. You know, whoever you work with, start having that conversation. The Surgeon General is already asking all of us to start having that conversation. Start having that conversation with them. Identify who might be isolated and or lonely. Again, there's a correlation between those two. Now, the isolation is probably some easier things you can do. Loneliness, a little harder to identify, and longer term relationships that need to be helping with them. And I think many of you, particularly those of you in communities, you know that probably the easiest thing to do is connect them with community. And you remember the circle with all the different communities, the intimate family and friends, probably the most important one. How many of you during the pandemic said, hey, you know what, I need to connect them to the kids and the grandkids, right? And you basically took an iPad and went from room to room with your mask and your full hazmat suit so that they could connect with them. That's what you did, and that's why that's important. Helping them to find their purpose is also important because helping them to connect with their contribution is important. And then resources for companionship. Now here's the key thing. Loneliness can be resolved in a couple of different ways. Obviously the best way is to create a new set of friends. You should never stop making friends, right? But sometimes it's hard. And short of that, companionship is something as we as professionals, we can provide. And if you find that they may be having issues that requires a professional, maybe even medical interventions, this is when you refer. Next slide. And this is the last one. And I've given this talk a number of times, but here's a caution, because I know a lot of us have good intentions and say, hey, you know what? I'm just gonna become their friend. Be careful, be real careful. And this is why I talked about the little circles there. And I don't know how many home care agencies I've talked to that basically said that they have lawsuits from family members because their caregiver has gone on and taken something from their loved one. Mom gave your caregiver this thing. She had no right to give. And the caregiver basically, well, you know what? She gave it to me. And she has the right to give away stuff, but the family member disagrees, okay? Why is that? Because the caregiver has unfortunately crossed the line to become a friend. And you do need to be careful about that, so be real careful. A professional caregiver, okay, offers companionship. That's great. That does mitigate loneliness. Provides comfort. Can help to connect with family and friends. That's probably the most important role. And it's more what we call the relational level, right? Not the intimate level. Remember, the 3 circles is that second layer. A friend, on the other hand, not usually a professional relationship. Not something you pay for. And it comes in the intimate, the closest circle, right? So, again, if you're very old, you've got cognitive challenges, you may not have too many of these. So that's why you may be left with just offering the companionship. Again, the cautionary note, beware of crossing the line, okay? The family conflicts. I've heard this so many times, accepting gifts from a care recipient. And many of your caregivers, you know, they have the best at heart on wanting to help this person. And the recipient becomes so attached to the caregiver, they think of them as family, they think of them as friends, they're happy to share things. Well, the recipient's family doesn't think the same thing. They're saying, I'm paying you, not to be a friend, but to help do this, this, and this. So be careful, and what I've typically asked people to do, you probably already have it if you're in the business, is basically have your policies and your guidelines to make sure about crossing that line, okay? Because there's liability. So be friendly always, be kind always, but I think it is important to maintain a bit of that professional distance. Okay, I'm up for questions. Anyone? Feel free to disagree or agree, and then at the end I'm going to share with you some resources. Oh man. You ready to take your quiz? Okay, well, let's talk about resources. Like I said, the community has a lot of resources. This is from Santa Clara County, called A Good Place to Connect, and they have a bunch of different resources in here. I recommend that, I already mentioned Friendship Line. By the way, I know the founder of Friendship Line, a wonderful guy. The next one is Friendly Voices. Rebecca, this is your cue, coming up.
Okay.
So she's gonna talk a bit about what they do.
Now that I moved my car.
Yeah, don't worry, I would have waited for you.
I didn't see the sign, so I
Get it from the-
apologize. Okay, thanks guys very much, I appreciate you. And I really wanted to talk about, Wesley's done a lot on resources from the community. A lot of you already know, or most of you already know, that you have senior clients who are isolated and lonely. And you know the physical and mental implications of this loneliness. Wesley's done a great conversation on this. And you know that having conversations with them, assuming you had time, would really improve their moods, their mental abilities, their ability to focus, etc. But we don't always have time. A lot of you you're busy with your clients and you're trying to do intakes or assessments or other evaluations or outreach. And so what I want to talk to you about is a resource for an organization that I am working with, which is Friendly Voices. Friendly Voices is a local nonprofit. We started at the beginning of the pandemic, recognizing that people really were lonely. Most of us couldn't get out, couldn't go and see the seniors. They were sitting in their rooms, everybody was isolated, couldn't come down to lunch, couldn't even go see their friends. And so we started a phone buddy program. And what our phone buddy program does is we provide free weekly conversations with isolated seniors. And as a senior, we're identifying as anybody 60 and above. We match those seniors with volunteers, with compassionate volunteers who reach out every single week to call somebody. So my buddy, for example, I've been speaking to for the last year or so. He's homebound. I call him every Friday morning just to say, how are you doing? So our volunteers are all screened. They're carefully screened, they're background checked. We do training and they're supervised, and we are HIPAA compliant. Okay. And we talk to them by phone. We found that trying to do FaceTime, trying to do Zoom, WhatsApp, whatever, becomes an impediment for people. It's too hard. They get tied up in that technology. So we take a technology that they're comfortable with, the phone. I call them every week. We're also, the community of volunteers, they really care about the people, but it's a neutral conversation. It's not the call, Mom, how are you doing? Did you take your meds this week? Mom, did you, have you gone to the doctor? Mom, have you finally moved the rug so that Dad doesn't fall? So we've all done that, right? So we're just calling and saying, hey, how are you doing? How was your week? We're also there to listen when they want to talk and talk when they want to listen, and which is really important for us, for those seniors. They feel validated, they feel not forgotten. So I'd like to offer anybody here who's interested, this is a free service, and I'd love to work with any of you who have people who you think, either people who you think would like this service or would be interested in volunteering for this, if you know of anybody. Just 1 second, then I will be happy to answer your question. We did recently get a grant, and so we are looking to expand. We are anywhere in Northern California. We're currently in Northern California. We're sort of defining loosely as sort of Monterey up to the border. And we have a very simple online referral. And so, which is confidential. If you have somebody, we partner with different organizations. It's an online. We take care of everything. We talk to you about the client, and then we follow up with the client directly. So if anybody, I'd love to talk to anybody afterwards who's interested, either has a client that you might be interested in this free service or interested in volunteering. So I've left some brochures, my card on the side. And you had a question?
So can a volunteer be an older adult?
Yes.
An 80-year-old can be a volunteer?
Absolutely.
Okay.
I think our oldest volunteer, can't remember if she is 80 or 90. So yes, so our youngest volunteers are, say, 25. So we're not using students, we're not using high school students who are looking just for community service hours. We find that they don't really have the knowledge and the connection with these people, with the seniors. So we want somebody who can connect. That's really important. And to say, we're looking for sustained conversation and friendship. Yeah.
I just wanted to take on, one of the things I love about what your organization is doing is, Wesley, you pointed out, sometimes we confuse loneliness with being alone. And so many people we know are lonely, but they may be a caregiver for a spouse, and they would benefit from what you're doing. Or somebody who's living in an intergenerational family situation where the grandkids are running off to school and the parents are taking care of the children or their various activities, and there's a grandparent who lives in the house. That person's lonely despite the fact that they are surrounded by their family members, and they would greatly benefit from this. So I just think that what you are doing is phenomenal.
Thank you. And we certainly have clients who have got aides, aides are there, and their aides are taking care of all of the basic things that need to be done. But the aides don't have time to spend as much time as people would like to just chat. And so, because they've got to get on to the next client. And so having somebody who will call once a week to say, just, how are you doing? And doesn't have any expectations.
All right.
Okay?
Thanks, Rebecca.
No problem.
So definitely pick up the Santa Clara guide, pick up her brochure. Actually, I didn't mention anything about what I do. TeleVisit, so I'll give you like the 1-minute overview. So we've been doing for about 12 years, mitigating isolation and loneliness. Now the difference with what Rebecca's doing, we do group virtual activities. We only do groups. You can't refer people to us because my board made a decision 10 years ago that we're not going to do one-on-one referrals because it's really hard, because we basically form people into groups. So we work with organizations which are generally funded by City of San Francisco, Santa Clara County, San Mateo, etc. But we're happy to partner with any organization, and we do phone-based audio conferencing without having them to learn anything, because we call them on the phone. And this, in fact, we just signed up Vista Center for the Blind. So we're going to do a new group for the blind. We do things in Chinese, Vietnamese, Spanish, Tagalog, not Tagalog, sorry, Toisan, a whole bunch of different things through our partners. So we work with various, mainly nonprofits, but we also started working with a telehealth company because they found SDOH really helped their patients to stay out of hospital, to reduce rehospitalization. So they've contracted with me to provide the group activities. And it's not a one-on-one. So we don't talk necessarily about what you want to talk about, but we basically do fun activities. And we have a tablet version as well, where you don't need to learn anything to get involved. So that's me. So once again, thank you to Villa Sienna. Thank you so much. Corinne is here. She's the executive director. I'm not going to call you out because your son already did all the talking. Yeah,
But we do have food.
I know. I want to thank you and Villa Sienna. And yes, now until 6 o'clock ish is going to be our networking time. So if you haven't met somebody, if you're new, either come up to me, come up to anyone, say who you are, exchange business cards. The piano is for your brochures and business cards, so you brought them, go ahead and leave them there. And